If you feel like you're treating more patients with type 2 diabetes, you're not alone. Does this case sound familiar? Rob has been a patient of Dr. Dine's for many years. Now 70, Rob comes in for his annual Medicare wellness visit, where Dr. Dine discovers his fasting glucose shows a new diagnosis of type 2 diabetes. She knows how Rob's life will change with this diagnosis and thinks about all she'll need to cover in the 15-minute follow-up visit. Just explaining the diagnosis could take the entire time. Then there are treatment options to discuss, medications to prescribe, specialists to consult, lab tests to order, a level of care that will repeat every 3 to 6 months for the rest of Rob's life, in the best case. Dr. Dine can't help wondering what she could have done differently to help Rob. She knows half of all adults over 65 have prediabetes and sees it all too frequently among her own older patients. Surely, type 2 diabetes is not inevitable for all of them. Perhaps not, thanks to a new set of services offered through Medicare Part B. Eligible Medicare beneficiaries now have free covered access to the Medicare Diabetes Prevention Program, or Medicare DPP. These evidence-based services help people improve their diet, become more physically active, and make other important lifestyle changes. Let's rewind and see how Dr. Dine could have handled Rob's case differently with Medicare DPP. Dr. Dine learns that clinical guidelines recommend regular screening of Medicare-aged adults for prediabetes and the referral of those with prediabetes to intensive lifestyle change programs, such as Medicare DPP. And because her practice participates in the MIPS portion of the Medicare Quality Payment Program, it can work towards meeting the requirements of 2 improvement activities available within MIPS. She anticipates no problem meeting the requirement to achieve and document systematic improvement in the quality of patient care using certified EHR technology for a certain percentage of her patients. Dr. Dine's practice implements a regular query within its EHR system to identify Medicare-eligible patients with a BMI over 25 who are at risk for type 2 diabetes. They screen out patients already diagnosed with type 1 or type 2 diabetes or with end-stage renal disease, as these individuals are not eligible for Medicare DPP. Rob is identified during this process, screened, and diagnosed with prediabetes. Dr. Dine refers him to a Medicare DPP. Dr. Dine's care manager lets Rob know he is eligible for a program that can prevent or delay progression of type 2 diabetes. When Rob learns that he will incur no cost, he is curious. The care manager explains that for prediabetes patients age 60 and older, the Medicare DPP has been shown to reduce the risk of type 2 diabetes by 71% over 3 years, compared to placebo. Rob enrolls in the Medicare DPP and attends 16 group sessions in the first 6 months, followed by 6 monthly maintenance sessions, all in a group setting led by a trained lifestyle coach. Dr. Dine and her team check in periodically with Rob to ensure he is on track. By the end of the first year, Rob has met the attendance requirement and achieved a 5% weight reduction, qualifying him for another year in the program. Rob walks into the clinic for his next Medicare wellness visit feeling great, much more physically active, and 6% lighter than when he enrolled in the Medicare DPP. Dr. Dine tells Rob his lab work looks so good, he is no longer considered to have prediabetes. She encourages him to keep up the good work, and they spend the remainder of the visit chatting about Rob's grandchildren and where he plans to go on his next vacation. PreventDiabetesStat.org